Let's begin this hour with the growing measles outbreak in the state of Texas. An unvaccinated child died yesterday at this hospital in Lubbock. It is the first death from measles in the United States since 2015. The largest outbreak to hit Texas in decades has now grown to more than 130 cases. It has also spread to New Mexico. CBS News chief medical correspondent Dr. John LaPook is here with us this morning. John, good to see you. So the HHS secretary during a cabinet meeting yesterday said that the measles outbreaks are not uncommon in the United States, and yet this is the first measles death, as we've reported, that we've seen in this country in a decade. So how concerned should we be, and give us the context?
Yeah, I am concerned because while it's true that there are intermittent infections, usually in pockets of communities where they're not getting vaccinated, the arc of this, you have to pull back the microscope, the arc of this is not heading in the right direction. There's increased vaccine hesitancy, and in fact, this flu season, the uptake was about 40% at one moment, it was a couple of weeks ago, compared to about 50% in the season before the pandemic. So we're seeing a hit that's public health and officials have taken, in terms of the confidence, people's trust in them, and we're seeing decreased vaccine uptake. This is an extraordinarily contagious infection. And I'll tell you something that people really need to think about. In addition to it being very infectious, it has a long incubation period.
What do you mean?
So when you if you were to get infected, it would take 10 to 14 days for it to actually get sick. During that time, you could travel all over the place.
And spread it.
And spread it to an airport, to a store, feeling fine. You may feel fine and not have the rash and yet still get infection. In fact, you can be infectious 4 days before you even get the rash.
Wow.
So this is the ability of not only is it very infectious, but you're all over the place and you don't even realize it.
What about little kids? Because it's my understanding you can't get vaccinated before 12 months to 15 months.
Right.
What if your children are too young to be vaccinated? How do you protect them?
So there's a couple of things for that. First of all, the antibodies, if the mother is immunized, the antibodies against measles cross the placenta and can help protect the child for up to 6 months. If there's breastfeeding, the same thing, the antibodies can cross. You want to have herd immunity, so get everybody in the family to get immunized, and there's protection there. You want to wash your hands.
But what about after that 6 months?
And then, then finally, after the 6 months, you can, if during an outbreak, actually get immunized at 6 months, from 6 to 12 months. But then you have to get 2 more shots later. The reason why they don't immunize people earlier is that those antibodies that cross the placenta can interfere with the vaccine. So it's not that it's dangerous or anything like that, it's just it doesn't work as well. But if you're having a big outbreak, you can actually get a vaccine.
Doctor, before you go, if you work in an office and you see a meeting on your calendar canceled, you're kind of excited. You're like, yeah, I got more time back. But we see this meeting canceled at the FDA about the flu vaccine, and it's like, well, hold on a second. Maybe that one was important. What are the implications here?
The implications, the World Health Organization is having a meeting, I think, tomorrow about it, and then a couple of weeks later, we're going to have an FDA meeting here where people figure out what's going on in terms of the vaccine for next season. You need about 6 months lead time because it's got to be grown up in eggs. It takes months in order to do that. If there's a delay in the meeting in the United States to figure out, well, which strains do we use, then there can be a delay in the availability of flu vaccine. So it's of concern, and it's also of concern to me and a lot of my colleagues in saying, like, what signal is that showing? So we hear there's a delay. Please talk to us. I've reached out to the FDA. I haven't heard back yet explain what's going on. Is it just that it's a couple of days later, rescheduled? Let us know.
Yeah, you hear a child died, you start paying attention.
No, big
Listen
time.
with both ears. Thank you very much, Dr. LaPook.